What if the reason you're feeling tired, disconnected, or distant from your partner isn't aging, but missing minerals? I'm Dr. Justin Keller, and today I'm revealing the top 5 minerals that quietly affect your circulation and intimacy after 60. These are nutrients your body used to absorb easily. But as we age, we need to give them a little more attention. We're going to talk about how magnesium helps you sleep and stay connected, why zinc can reignite physical desire, how iron might be the reason for your low energy, what L-Arginine does to restore blood flow, and how vitamin D could change your mood, your strength, and even your closeness with someone you love. And stay with me until the end, because the first mineral we cover is the most surprising and the most important. It's one I see missing in nearly every patient over 60, and it's often the root cause behind low energy and fading intimacy. Before we dive in, tap that like button and subscribe to Glowing Age. It helps me keep bringing you real, helpful insights you won't hear in a 10-minute doctor's visit. Also, drop your city in the comments. I want to see where everyone's watching from. We're building something meaningful here, and you're a part of it. Now let's get into it. Forgotten mineral, powerful results. Magnesium. Have you ever had a night where your legs wouldn't stop cramping, or you felt your heart flutter just a little offbeat, and you thought, maybe it's just aging? What if I told you it might be something as simple and as fixable as a magnesium deficiency? I'm Dr. Justin Keller, and I've seen this more times than I can count in my practice. People over 60 coming in with unexplained fatigue, poor sleep, anxiety, cold hands and feet, and even a declining sense of physical intimacy. These symptoms often get written off as just getting older, but they're frequently tied to one key mineral: magnesium. Magnesium plays a central role in over 300 biochemical reactions in the human body. It's responsible for relaxing blood vessels, supporting steady heart rhythms, regulating muscle and nerve function, and even helping to maintain healthy levels of testosterone and estrogen, hormones essential to your vitality and sense of connection. As we age, our body becomes less efficient at absorbing magnesium from food. Combine that with diets low in magnesium-rich whole foods, and it's no wonder that up to 70% of adults over 60 are estimated to be magnesium deficient, according to data from the National Institutes of Health. One of the first things magnesium affects is your vascular health, your circulation. Without enough of it, your blood vessels stay tense and constricted, your blood pressure rises, and blood doesn't flow as freely to your extremities. That includes the brain, the hands, the feet, and yes, the parts of the body responsible for intimacy. Poor circulation can lead to difficulty achieving or maintaining arousal, and a lack of physical response even when the desire is still there. But here's what I want you to know: it's not about performance, it's about presence. When blood is flowing well, your brain is sharper, your mood is lighter, and your body is more responsive. This creates the conditions for connection, for closeness, not just physically, but emotionally too. I once had a patient in his late 60s, we'll call him Henry, who told me he just didn't feel like himself anymore. He was tired all the time, restless at night, and said intimacy felt like trying to light a wet match. We ran labs. Sure enough, magnesium levels were low. Within 6 weeks of a targeted plan that included magnesium-rich foods and a low-dose supplement, he was sleeping better, his energy had returned, and he told me he and his wife had started taking evening walks again, hand in hand. That was the moment he knew something had shifted. So where can you get magnesium naturally? Start with leafy greens like spinach and Swiss chard, pumpkin seeds, almonds, black beans, and even a bit of dark chocolate. Yes, really. Many older adults may also benefit from a magnesium glycinate or citrate supplement, which is gentler on the stomach and easier to absorb. But always talk to your healthcare provider before adding any supplements, especially if you're on blood pressure medication or diuretics, which can interact with magnesium levels. Don't overlook this mineral. It's not trendy, it's not flashy, but it's foundational. If you've been feeling more tired, less connected, or like your body just isn't responding the way it used to, magnesium may be the quiet partner you've been missing. You don't need to turn back the clock. You just need to give your body what it quietly asked for all along: support. The intimacy enhancer, zinc. Let me ask you something simple, but important. When was the last time you felt truly alive in your own skin? For many people in their 60s and beyond, the answer often comes with a pause and sometimes a little sadness. That quiet loss of energy, confidence, and connection, it's more common than you think. But what if one mineral could play a surprisingly powerful role in bringing some of that back? Zinc. Zinc is one of the most overlooked yet essential nutrients when it comes to intimacy, vitality, and emotional closeness, especially as we age. I've treated hundreds of patients in their 60s, 70s, and beyond who had no idea that a simple zinc deficiency was contributing to their loss of interest in intimacy, their mood swings, and even their reduced ability to heal from small cuts or colds. Zinc is a trace mineral, meaning our body only needs small amounts, but the impact is outsized. It's crucial for maintaining healthy hormone levels, including testosterone, which, yes, is still important in both men and women after 60. This hormone doesn't just influence physical desire. It's also tied to motivation, energy, and confidence. Things we often forget are deeply connected to our intimate lives. In men, low zinc can lead to decreased sperm count, reduced erectile function, and slower recovery times. In women, zinc supports estrogen balance, skin health, immune defense, and even lubrication and sensitivity. When these systems are off balance, we don't just feel it physically, we feel it emotionally. Sometimes it shows up as irritability, sometimes as disinterest in physical closeness. And more often than not, it's mistaken for depression or just getting older. One patient, Barbara, 66, came to me feeling disconnected from her husband. She said, "It's not that I don't love him, I just don't feel there anymore." Her labs revealed low zinc, along with borderline low testosterone. She began increasing zinc-rich foods and added a supervised supplement. Within a couple months, she said something I'll never forget. "I feel like I woke up inside myself again." So where does zinc come from? Shellfish, especially oysters, are incredibly rich in zinc. Pumpkin seeds, lentils, cashews, chickpeas, eggs, and even beef or lamb are good sources as well. For vegetarians, it's important to note that plant-based zinc isn't as easily absorbed, so a supplement might be necessary, but only with medical guidance. Too much zinc can suppress immunity and block copper absorption, so balance matters. The good news, improving your zinc levels is not about chasing youth. It's about reclaiming presence, that sense of being connected in your own body again. The warmth of a hug, the electricity of a touch, the quiet joy of closeness that doesn't need to be rushed or perfect, just real. When people talk about intimacy after 60, they often reduce it to mechanics. Pills, procedures. But the truth is, real intimacy starts with feeling well, feeling confident, and feeling whole. And something as small as a trace mineral can help build that foundation. So if you've been feeling distant, depleted, or unsure of what changed, consider looking at zinc. It's not a miracle fix, but it might just be the gentle nudge your body's been waiting for. The unsung circulation hero. Here's a question I ask patients more often than you'd expect. Are you tired, or are you running on empty? Because there's a difference, and iron often holds the answer. By the time most people reach their 60s, they've adapted to a quiet kind of exhaustion. They chalk up the low energy, the shortness of breath, the pale skin, the cold fingers and toes, even the lack of interest in intimacy, as normal aging. But in many cases, especially in older adults, these are classic signs of iron deficiency, or what we call anemia. Iron is the mineral responsible for helping your red blood cells carry oxygen throughout your body. When your iron levels drop, your entire system slows down. Your muscles don't get the oxygen they need, your brain fogs up, and your skin starts to look washed out. Even your heart works harder to compensate, leading to fatigue, dizziness, and an overwhelming sense of physical heaviness. Now here's the part most people don't know. Good circulation and healthy intimacy depend on oxygen. Without enough oxygen-rich blood reaching your muscles and tissues, including those involved in sexual response, it becomes more difficult to feel aroused, to stay present, and to enjoy connection. For many of my patients, the issue isn't psychological at all. It's physiological. Their body simply doesn't have enough iron to support the flow of life where it matters. I once treated a woman in her early 70s. Let's call her Elaine, who came in complaining of persistent fatigue and shortness of breath. She said she had no interest in going out with friends anymore, let alone being intimate with her partner. "It's like my spark's gone," she said. Blood work revealed she was moderately anemic. Within weeks of increasing her iron intake through food and carefully monitored supplementation, she reported brighter skin, improved energy, and for the first time in years, she said she and her husband danced in the kitchen again. Her spark hadn't disappeared, it was just undernourished. For women over 60, iron deficiency can still be an issue, even long after menopause. Medications, chronic inflammation, gastrointestinal changes, or simply inadequate dietary intake all play a role. And for men, low iron is less common but not unheard of, especially if there's a history of ulcers, internal bleeding, or poor diet. So where can you get it naturally? Start with iron-rich foods like red meat, organ meats, like liver, lentils, chickpeas, spinach, fortified cereals, and blackstrap molasses. But here's a key tip. Pair those iron-rich foods with a source of vitamin C, like citrus, tomatoes, or bell peppers. Vitamin C helps your body absorb iron more effectively. And avoid drinking tea or coffee with iron-rich meals, since the tannins in those drinks can interfere with absorption. It's also important to note, never self-prescribe iron supplements. Taking too much can be dangerous and lead to iron overload. Always have your levels checked by your doctor first. When we talk about living well after 60, we often focus on what to slow down, reduce stress, cut back on sugar, avoid overexertion. But sometimes the answer isn't about doing less. It's about giving your body more of what it truly needs. Iron is more than a nutrient. It's your fuel. It gives you color, warmth, endurance, and yes, it even supports those quiet, tender moments of connection we so often take for granted. So if you've been moving through your days in a fog, struggling to feel energized, or wondering where that spark of joy has gone, don't ignore it. It might be your body whispering that it's time to refuel. The blood flow booster, L-Arginine, technically an amino acid, but functions like a mineral. Let me tell you something most people don't learn until they're much older than they should be. Good circulation is the quiet foundation of every part of your health, including your intimacy. Without it, nothing functions the way it should, especially below the waist. And one of the most powerful natural ways to support circulation after 60 is with something called L-Arginine. Now, L-Arginine isn't technically a mineral, it's an amino acid. But in the body, it behaves like one of the most essential building blocks for vascular health. It helps the body produce nitric oxide, a compound that relaxes and widens blood vessels. That widening effect is key. It improves blood flow, lowers blood pressure, and enhances the delivery of oxygen and nutrients throughout your entire system. That includes your heart, your brain, and yes, your most sensitive areas. In my urology practice, I've seen dozens of men and women in their 60s, 70s, and even 80s struggle with reduced blood flow to their pelvic region. They often say, "I still feel desire, but nothing's happening down there." That disconnect between what the mind feels and what the body does can be frustrating and even heartbreaking. But the issue often isn't emotional, it's circulatory. L-Arginine supports the body's natural ability to respond, physically and emotionally. In men, studies have shown L-Arginine can help with erectile function, especially when combined with other nutrients like pycnogenol or zinc. But this isn't just a male solution. In women, improved blood flow can enhance sensation, lubrication, and responsiveness, all essential for a fulfilling intimate life, and the effects extend beyond the bedroom. Better circulation improves cognitive sharpness, heart health, exercise tolerance, and even sleep quality. This is whole-body nourishment. I remember a couple, both in their early 70s, who came to me feeling like their connection had become routine, flat. The husband had mild erectile dysfunction. The wife described herself as numb. Neither of them was ready to give up on that part of their relationship, but they felt stuck. After ruling out other conditions, we introduced a daily dose of L-Arginine through both diet and a modest supplement. Within a month, the husband reported better firmness, but what surprised them both was the emotional shift. He said, "We're touching again, not just out of habit, but because it feels good." Sometimes the body just needs help getting the message across. So where can you get L-Arginine naturally? Turkey breast, chicken, peanuts, chickpeas, lentils, pumpkin seeds, and dairy all contain solid amounts. Watermelon also contains a related compound, citrulline, which converts into L-Arginine in the body. For those who may not get enough through food alone, there are supplements available. But again, a word of caution. If you have heart disease, low blood pressure, or are taking nitrates, always consult your doctor before starting L-Arginine. It can interact with medications or worsen certain conditions if not properly managed. This is not about chasing youth or becoming someone you used to be. It's about giving your body the tools it needs today, so you can continue to live, love, and connect in a way that feels real, vibrant, and right for you. When blood flows well, life feels easier, brighter, closer. That's the quiet power of L-Arginine, and it's never too late to invite that power back in. The sunshine mineral, vitamin D. What if I told you that something as simple as sunlight could quietly restore not just your bones, but your mood, your energy, and even your intimacy? Vitamin D has long been known as the sunshine vitamin, but in reality, it behaves more like a hormone, and it touches nearly every system in your body. For those of us past 60, it becomes even more essential. Why? Because as we age, our skin becomes less efficient at converting sunlight into vitamin D, and our kidneys are less able to activate it. At the same time, we're spending more time indoors and often taking medications that interfere with vitamin D absorption. What's the result? A slow, steady depletion, and with it, a cascade of symptoms that are often mistaken for normal aging. Chronic fatigue, low mood, joint pain, frequent illness, brain fog, poor balance, and yes, even a fading interest in intimacy. As a urologist, I often see patients looking for answers about low libido, reduced physical responsiveness, or feeling emotionally disconnected. What surprises many of them is that vitamin D plays a direct role in testosterone production, estrogen regulation, and dopamine signaling, all critical to how we feel, how we connect, and how we engage with the people we love. Low levels of vitamin D have been linked in multiple studies to lower sex hormone levels in both men and women, reduced desire, and even an increased risk of erectile dysfunction. But the impact doesn't stop at hormones. Vitamin D also reduces systemic inflammation, which improves circulation, enhances immune function, and supports cardiovascular health, all foundational for both intimacy and overall vitality. I remember a man in his late 60s, George, who came to me after feeling flat for over a year. He wasn't depressed in the classic sense, but he had no drive, no spark. He didn't want to engage with his wife, didn't feel like getting outside, and said he felt like life was passing through him. His vitamin D levels, very low. We implemented a daily supplement protocol and encouraged him to spend 15-20 minutes outside in morning sunlight, several times a week. Within 6 weeks, the shift was undeniable. He was more alert, more connected, and simply said, "I feel like I'm back." So how can you support your vitamin D levels? Start with safe sun exposure. Just 15 to 30 minutes on your arms, hands, and face a few times a week can make a difference, depending on your skin tone and where you live. Add in vitamin D-rich foods like salmon, sardines, fortified dairy or plant-based milks, egg yolks, and mushrooms. For many older adults, especially in northern climates or with darker skin, a supplement may be necessary. Most people over 60 benefit from at least 1,000 to 2,000 IU per day, but your doctor can guide you based on your blood levels. And here's something important. Vitamin D works best when paired with magnesium, which helps activate it in the body. That's why these minerals often show up together in a well-rounded wellness plan. Everything is connected. Think of vitamin D not just as a nutrient, but as a signal to your body that it's safe, supported, and alive. When levels are healthy, your energy returns, your bones strengthen, your mind clears, and your ability to connect emotionally and physically deepens. Aging doesn't mean withdrawing from life. It means choosing more intentionally the things that help you feel like yourself again. Vitamin D might not feel like a game changer in the moment, but for many of my patients, it's exactly that. Quiet, subtle, but powerful. The sunshine mineral doesn't just come from the sky. It comes from giving your body the light it's been missing, inside and out. You don't need to accept fatigue, distance, or discomfort as just part of aging. Your body still wants to support you. It just needs the right tools. The 5 minerals we talked about today, magnesium, zinc, iron, L-Arginine, and vitamin D, are not just about physical health. They're about restoring energy, rebuilding confidence, and deepening connection with the people who matter most. Start with your next meal. Step into the sun. Talk to your doctor about what your body might be missing. It's never too late to feel better and closer. If this video helped you, please hit like, subscribe to Glowing Age, and share it with someone who needs a little encouragement right now. Every click helps us reach more people who want to age with heart, purpose, and quiet power. I'm Dr. Justin Keller. Thank you for watching. Stay well and keep glowing.